The following is a presentation of the Healthcare Facilities Network.
Hello, and welcome to the Healthcare Facilities Network. I'm your host, Peter Martin, Vice President of Business Development for CREF, with offices in Boston, Massachusetts, Dallas, Texas, Salt Lake City, and Fort Lauderdale, Florida. It's late in the day. My accent came through there. You can find more information about CREF online, obviously, but we're not here to talk about that. We are here to talk about a distinguished group of guests who are joining us today. After they introduce themselves, I'll kind of give you the genesis for what we're looking to do in this different type of episode. Gentlemen, this is the largest group I've ever had on. The previous large was me plus 3. Now we have me plus 4. So you've already started out ahead of the others who've ever appeared on the Healthcare Facilities Network. And Andy, welcome back for a second time. So Skip, though, why don't we start with you to introduce yourself, and then we'll move to Andy, we'll move to Tim, we'll go to Brian.
You got it. Thanks, Peter. For those who don't know me, I'm Skip Smith. I was the System Vice President for Physical Asset Services for CHI and left there in 2019 at the end of the merger with Dignity Health, and which became CommonSpirit Health. During my tenure at CHI, it was my pleasure to work with the rest of the folks that are on this call today or on this cast, and to build a program that nobody else was doing at the time and now seems to be mainstream. So it's fun to get together with these guys and talk about the journey that we were on.
Thank you, Skip.
Hey, well, good day, everyone. I'm Andy Woommavovah. I'm the current Vice President for Facilities, Energy, and Infrastructure for CommonSpirit Health. I am about a week into this job, this role. I come into this role from leading facilities and construction and national program development at Trinity Health. Did that for 3 years. And prior to that, I was part of that CHI Dignity merger that Skip mentioned. Before the merger, I worked for Skip, reported up to him, led a facilities and construction national program at CHI. And so I tell folks now that I'm coming back to CommonSpirit to continue the work that we started as this team, many years ago. I'm coming home. So I'm very happy to be back at CommonSpirit. I'm very happy to see this group of guys on the call with us today. Worked with them in the past and look forward to working with them in the future. Tim.
Hello, everyone. Tim Livesay here, System Vice President, Environmental Services, Laundry and Linen for CommonSpirit Health. Been on this journey for 34 years. It's a calling for me. Blessed to be a part of this team.
Thank you, Tim.
Hi, good afternoon, everybody, or good morning. This is Brian Symmonds, System Director of Projects for CommonSpirit. Been with the organization since 2008. And currently, I work on projects primarily for clinical engineering and environmental services, but also have oversight within clinical engineering for our CMMS program, medical device security, and then quality and safety within clinical engineering. So I started working with some of these guys. I think Skip and I started working together somewhere around 2013-ish or somewhere around late 2014, 2015. Officially became a part of his team. And then I think with both Andy and Tim, kind of got involved with projects with them probably back in 2013, 2014-ish before I officially joined the team. So love working with these guys and great to see them all again.
Excellent. Thank you, Brian. Thank you, gentlemen, for joining. And so the common theme is CommonSpirit. The common theme is Catholic health initiatives. And just for a little background, Skip is a very modest man, and Skip is very well respected. And this year, 2024, at the ASHE Innovation, I still have to catch myself, right? The Innovation, not the ASHE Annual.
Yeah, I never get the initials right anymore.
Yeah, I know. But Skip was awarded the President's Award at the conference this year in Anaheim, and I was there. And as I was sitting in the crowd, I thought to myself, it would be a great episode to talk to Skip and talk to his former team members and talk about how he created, and how with help, I'm sure you will say, how with help you created this team, a national team in facilities management. I'd be remiss, Skanda Vanderveld, the president of ASHE, gave you the award. And we had, my partner, Jack Goslin, when we were doing recruiting, Jack introduced me to Skip. Jack did a lot of work with Catholic health initiatives. I met a lot of your former team members there, and what always stood out was you just had a great group of people who worked for you. And so as I was sitting in that audience, I was thinking of Skip like a football coach, and you see it more in football than in other sports, where they'll put up the head coach and then they'll show the tree, right? He's an offensive coordinator, head coach. And I was like, it would be great to talk to Skip kind of about that formation and how you went about doing it. Because listen, you guys are all involved in healthcare facilities. That's a key, that teamwork, that camaraderie, the composition. And so Skip graciously Skip graciously said that, sure, he'd like to talk about the journey that they went on at CommonSpirit. And so that's where we start. So that's the genesis of it, kind of team formation, national program. But I really think, Skip, I'd like to go back to that beginning. So you joined CHI 2001. I didn't realize the timing, in September of 2001 as a director. And then 2011, I think you became VP of Physical Asset, the VP of the Physical Asset team for CHI.
Correct. So yeah, I quit my job at the hospital about 3 weeks before 9/11. Wow. And was taking a break because I was starting the new job the week after 9/11. And what I envisioned was going to happen on that first day at work totally vaporized. And I've affectionately referred to the first couple of months at CHI as my Maytag repairman days. Nobody traveled, nobody went anywhere. Did a lot by phone. I'm the new guy, so nobody in the system knows who I am, what I'm doing. My title was actually the Assistant Director of Clinical Engineering, responsible for facilities. And there was no national program at all as it related to facilities management and some of the other services, which eventually became asset services. However, we did have the clinical engineering program, which was a national program. And a lot of what we've done to build the physical asset services over the next 23 years or so really followed that model. And I would say it was always from the ground up. We were always looking out to see what do they want from us in order to build the programs. And Tim and Brian will talk about this, I'm sure, because they were the poster child for how we did that. Facilities management wasn't nearly so elegant. So I'm in my Maytag repairman days, and I get a call from the quality people saying, we've got a presentation to the Joint Commission Preparedness folks in January, and we'd like you to talk about the environment, care, and life safety. And I thought, great, we'll do it. I said, oh, and you're the last presenter on the last day in Las Vegas. And it's like, oh, this is a setup. So anyway, lo and behold, last day, last session, there's not an empty seat in the room.
Wow.
All the coordinators were there. And when I walked out of the room, I really went from doing nothing but trying to research and think about what do we do and how do we do it and collecting information to, I believe the number was 17 invitations to come and do mock surveys. So, which kind of started the next 4 years for me. And so I was pretty much the Lone Ranger. I didn't have the luxury of this talent that's on the screen with me at that time. I went out and I was doing the surveys, and it really wasn't what I wanted to do. But the silver lining in it was where a facility director sitting out in a market would probably never call the corporate facility person to come out and visit. All of a sudden, I've got quality people and Joint Commission people saying, he's coming.
Wow.
And there wasn't any debate about it. And so, as everybody knows that is on here, I'm just a shy, shrinking violet. And so going out and making friends was, the thing of the day. And so went out and started to build relationships. Was really how it started. That's how I met Andy. Andy was in Chattanooga as a project manager at the time. And I'm sitting at a desk and he's sitting over at another desk. And every time he'd come by, he'd ask me another question about what do you do? And,
Wow.
why are you here? And those kinds of things. And so that was really the way it started.
So Skip, can I ask?
CHI,
So
go ahead.
you're within your CHI employee surveying within CHA hospitals going national relative to Joint Commission Environment and Care. You're still within your system. You're doing this within the
Correct.
system.
Yeah,
Okay.
I wasn't outside the system. These were all our hospitals that I was visiting. At the same time that was happening, our supply chain was really very aggressive at nationalizing. Everybody was dialing for dollars at that time. And so they created a model, they called them regional operating conferences. And being a part of supply chain, I got to tag along with that. And I was able to invite the facility leadership to come to those meetings as well. And half of those sessions, they were 2 and 3 days long, would be just the facility guys, the men and the women that were present at that time. And I would have groups, I think there were 6 of them or 7 of the operating conferences. And I would have 20, 25 people. We were about 68, 72 hospitals at that time.
Okay.
And we talked about it. It's like, and they would ask me, what are you going to do? And my response was, what do you want me to do? And so, and I had a lot of freedom. Phil Mears, who was the leader for Senior Vice President of Supply Chain, and Steve Kerberg, who was Vice President of Clinical Engineering, both are very entrepreneurial. And they kind of cut me loose. A funny story is right before I started, I think it was like the Thursday or Friday before 9/11, they invited me to lunch. And so the 3 of us were sitting having lunch, and pretty soon they said, well, they're looking at each other kind of smirking, and they go, should we tell him? It's like, oh God, I don't have a job or something. They started laughing and they said, well, we don't know what you do. And we don't know what you can do, but we know we need you. So,
and you were hired in as a director of FM
go
at the
figure.
time. Oops. Director of FM.
Yeah. I'm the assistant director for clinical engineering.
Have that latitude, have somebody just say, go figure it out. I mean, it was manna from heaven, and that's just what we did. So the fact that I wasn't under any constraints freed me up to just go, well, what do you guys want? What do you need out here? And that was kind of how it started as we went down the FM road. Eventually, they were turning to us to help with talent. So we leveraged some of the clinical engineering folks to be leaders in facilities management and worked with them. We also did talent searches and so on. So it was really kind of just a gradual, slow rolling thing until you get to about 2005. And then that's when I hired Dennis Smith, because we had direct reports, and to continue to build the programs and stuff, we needed bandwidth. And so Dennis came on board. And then shortly after that, he brought Andy on board as well. The CHI in the beginning was a federation of hospitals. And they would tell you they were a corporation and they operated as a system, but really they were a federation where they would look for best practices and they would push best practices out. But nobody was really under any direction that they had to follow a national program, national policies, that kind of thing. They were also very focused on not growing national staff. So somebody being brought on was a big deal to add on to them. Over time, that started to change. And it became even more important around the dollars and service and how do we improve it. And so you start getting up to the 2015 area, or time frame, and we were coming back and it's like, what else can we do? Where else can we go? And that was when environmental services popped up on the screen. And I'll let these two tell you about it, but two kind of funny stories about these two guys is that first, these are serious leaders here. They are the best in the market. They're the best with their people. They are content experts. They are really, really good at what they do. However, back when I was a bit more naive and we were first getting to know each other, Tim, I met on a supply chain call. And I can remember listening because Tim's got a habit of rolling on every once in a while. And
what are you doing right now, Skip? Come on, from the best.
The news is that I kick him under the table. And it's like, who is this guy? And eventually we really did talk and he had a good idea. Brian was kind of similar. Brian was working for IT and he was a project manager, program manager for them. And we were working on some things together. And I think it would be fair to say that I wasn't the biggest fan of IT in the world.
Yeah.
And there were a lot of other things that were going on in the background at the time. And Brian kept coming back to me. He goes, why don't you let me come to work for you guys? And it's like, yeah, it's like, hiring freeze, whatever. It's like, and I would think about it. And finally, one day it came in, probably on about the fourth or fifth time. And he goes, why don't you hire me and have me work for you? And I remember stopping and looking at him and going, why do you want to come to work for us? And he said, because you guys do projects or you design projects and then you actually do them. And it was like, oh. And Brian brought a whole new perspective to how to move this stuff along. And so I'll stop there and let Tim talk a little bit about it, and then we can go back to Andy about the FM piece, if you will. So, Tim, you want to pick up from where I just left off?
CREF provides strategic real estate solutions that enable organizations to get the most out of their physical infrastructure. At CREF, the difference is we're not just advisors, we're operators. Our expertise in strategic asset advisory, project management, regulatory preparedness, and finding operational efficiencies allows us to provide organizations with end-to-end visibility and insight into their real estate portfolios and physical assets.
Absolutely. This is very overwhelming for me because it brings back a lot of great memories and a lot of risk that Skip took in my world and what we do for a living. Because when he first started looking at this, he was potentially entertained bringing an outsourced group in to do environmental services. And I spent half of my career with the outsourced group and the remainder of my career, 18 years now, with our national in-house program, which, by the way, happens to be the largest in the United States of America. And we're very proud of that fact right there. But Skip had a group come in. They assessed what we look like in the St. Joseph Health market, and they were comparing at the time the Louisville Jewish side of the world against the St. Joseph side, in-house, outsourced. We blew them away, and we were very proud of that, very excited about that. So this young punk kid from Kentucky was getting on this gentleman's nerves a little bit, who I love to ramble. And I'll never forget, I was down in the basement, right underneath where I'm sitting in my garage, leaning up against the car, and I had a conversation with Skip, and it clicked for both of us. Skip gave me the keys to the kingdom and said, go get him, Tiger. And that's what we did. And then, understanding I was a loose cannon, he assigned Brian to me to keep me in check, which made me an absolute nervous wreck because Brian is so structured, organized, and systematic in everything that he does. And I'm like, let's just go and let's get it done. So it was great. And I got to tell this story about me and Brian because it's just awesome. If you have a quarter, Brian is going to see 2 dimes in a nickel. I'm going to see 25 pennies. It's the same thing. we always got to the same goal, but we always looked at it with different sets of eyes. And that's what's made us so
Still do to this day.
Yes, we still do that
To this day.
What we did, Skip positioned us for success. And what I mean by that is we got the right people around the table. We got finance around the table. We got nursing around the table. We got infection prevention around the table. We actually got boots to the ground EVS leaders around the table. Skip facilitated that until he had the confidence level that Brian and I got it. And then Skip said, keep me informed, stepped out and let us take over and continue to move that work forward. And it has been a marvelous journey to get where we are today. We've been recognized by AHE as a best practice in the community. We've been recognized for our program when I say multiple, numerous times over the last 8 years by Joint Commission as a best practice for our program and process. We've been published by Healthcare Hygiene Magazine. So I just love what we do, and I love that someone saw in us what we maybe didn't see in ourselves at that moment in time and helped draw it out of us to just take what we do and the passion that we have for what we do and then execute it within within the healthcare arena. I didn't realize I'm an operator. I didn't realize I had to be a salesman too. We had to sell what we did out in because I can't tell you how many times, folks, what are you here for? I'm here to help. No, what are you here for? I'm here to help. And I finally started getting their attention, and Skip and I were together at a meeting once when I said this, and I thought folks were going to fall out of the chair. They said, what do you do for a living? I said, I help save lives. And that's what environmental services does by providing a clean, safe environment. Brian, add into that. I'm taking up all the time.
Oh, you're all good. I just wanted to tag on to a couple of things that both you and Skip said. So to kind of expand on what Tim said with bringing together, I think one of the tremendous things that Skip really did for us and led with us is when we started this journey for kind of the enterprise-wide vision for how to go with an in-house program for EVS, is Skip made sure that we had the right people at the table for that conversation, not just the believers in what we were doing. Skip made sure to say, hey, to be successful, I need both believers and non-believers for multiple functional areas. And I think Tim and I kind of looked at each other like, hey, Skip, what are you doing having these other kind of folks at the table? Don't we want to try to streamline it through the other folks who are already on board? And Skip is like, no, we need through collaboration, through the buy-in. The way to sell it is, we need these non-believers from the get-go. And that's one of the biggest things in terms of that maybe I've taken from there's many things I've taken from Skip and the way he leads, but that's one of them is don't be afraid of those non-believers, engage with them, partner with them, and together figure out what the right path is forward. So I just wanted to kind of add that onto that. And then wanted to go back to just for a second, a couple of the comments that Skip said. So like he said, so I came from a very structured program management office. All about process. We had process up the yin-yang. It was process to death. I'm a believer in a certain part of that, but back to Skip's comment about getting things done is another thing I really attribute to and really thank Skip for his leadership style is what I'll call is right-sizing the level of process that you need to be able to get things done is a term that I would use in cutting through the red tape. And so I really meant that when I said that was sometimes I would get frustrated with we spend so much more time talking about it in my prior role, as opposed to just rolling up our sleeves and getting started and doing it. And so absolutely love working with those guys. I think Skip also just back to what I think Tim reiterated it. Tim, it sounds like even with the way that Skip started it, Skip empowered all of us to be leaders, to be decision makers. I bet you if you asked any one of the other three of us on the phone, Andy, Tim, myself, if you said what's one phrase that we all hang our hats on that describes Skip, just one phrase, I bet every single one of us would say proceed until apprehended.
Proceed until apprehended.
And all of us learn that from him, and we all continue. I know I continue. I know Tim does, and I'm assuming Andy does too, but it was a form of leadership with we're not going to wait for folks. We're not going to wait for the red tape. We're going to do things the right way. but doggone it, we're going to get some stuff done. And so, I always remember that. And it changed me forever as a leader in terms of how to outlook. And I came from an organization that was very process heavy, very much about, again, you talk so much about getting things done instead of actually rolling up your sleeves and doing it. So.
And I want to jump back on that real quick. Skip had the ability to not call you out, but the ability to call you up. And that's what he did with us for this program is it's like he put us in, coach, and he did. And, you know, a lot of times folks think about accountability as being called out, when in fact it's not. It's about being called up. Accountability is being called out, when in fact it's not. It's about being called up.
Yeah.
Excellent. Well, you know what? I got to remember that proceed until apprehended.
Yeah.
Go ahead.
So Brian stole some of my thunder there, but that's okay, Brian. You know, this has been just kind of a wave of memories that have just kind of been slowly rolling over me over this last 15, 20 minutes we've been talking. And, you know, one of the things that I think about is Skip, you know, he's a humbled leader, right? And he has this knack for picking talent. I spent 32 years in the military, and one of, you know, the ground rules is surround yourself with excellence. And when you do that, when you have to step away or you get promoted, you move on, everybody can continue to move that mission forward. And one of the other things, you know, to Brian's point about pursue until apprehended, I remember Skip and I were at one of the national meetings. We were probably having a refreshing beverage. And he said, why do you think we never get caught? You know, when you understand our role is pursue until apprehended. And it was a really very simple answer for me. I said, Skip, we're doing the right thing. Who's going to stop us if we're doing the right thing? And that touches on what Brian said and what Tim said. When you think about transparency, bringing all the people into the room that need to be there, when you do that, they're like, hey, they're not on a power grab. They're here to help us. You know, they're from the national office, and they really are here to help, right? So it's kind of like, I'm from the government, I'm here to help. But we were out there helping people, and we were gaining their confidence. And Skip always challenged us to be spiritually grounded, because we're a not-for-profit, faith-based organization, and we need to keep that on our sleeves. And when you lead into that, and when you do, it's like, okay, I'm in. When you start a meeting with a reflection, okay, I'm in. You've centered them. And now they're willing to listen. They understand that it's not you about you, it's you about the good of the whole. And that kind of leads into the other point about relationships. Skip was big on relationships. I spent 3 years at Trinity Health. We built a business plan, and we're starting a national program with facilities and construction. I've got all the right leaders in place. That made it easier for me to move on, to come back home to CommonSpirit. But the way that I built those teams was through transparency and trust. When you think about relationships, that builds the trust, and they're like, okay, this makes sense. We're really here to do the right thing. The other thing that Skip put in place that really helped us all is we started having national meetings. So we would find ourselves in Denver, EVS, clinical engineering, facilities and construction. We would all be in one big room, and you talk about networking and folks having fun. We would mix them up. You know, we would make sure that they understood who each other were. And what you saw was these overlapping circles with all of these sister programs, include security. And we wouldn't let each other fail. We're like, oh, hold on. Is EVS here? Is CE here? If they weren't in the room, we would hold the show up until they got into the room to make sure that everybody had full understanding of what we were doing. And that kind of leads into, as CHI started building a national construction program, Skip brought leaders into the room, and he found himself kind of doing some of this problem solving for major projects. And it all boiled down to relationships and communications. And Skip walked into the room, everybody kind of just calmed down, and they talked through it. And it was that ability to have that vision on what needs to be accomplished. What does the end state need to look like? And when you think about it like that, the leaders that kind of spin out of that orbit, they continue to do that whatever orbit they're in. And so they're building that same synergy, that same mindset. They're building those same leaders for the future as Skip did with us. And I'm forever touched by him. And I'm very thankful for that first interview. There was Dennis Smith, Skip Smith, and Melanie Smith. And then here was a Woommavovah. And I was like, I don't think I'm going to get hired. I'm not a Smith. But I made it. Here I am. So I appreciate that, Skip.
That's great.
So it's funny you guys bring up the proceed until apprehended. And the genesis of that was we were kind of known for it, first off, and because we did go out and do things. And as I was saying earlier, we had a license to do it and to go out and do the right stuff. And when I was promoted to vice president, CHI had a program for new vice presidents where you did 360s and all of that, but you also got a mentor. And I picked an executive vice president who arguably we started off on a rocky foot and eventually ended up with an amazing friendship. But I went in to see him one day and we were talking about something, and I made some comment about, I'm just waiting to hear what they have to say. And he started laughing. He goes, "Do what you do best." And I said, "What's that?" And he goes, "I'm going to tell you right now, the closer you get to the top, the less clear it is. So just proceed until apprehended." And we took that and we ran with it. And it served us very, very well.
Yeah.
The other thing I want to go back to just a little bit is when these fellows are talking about their programs and what they went out to build, it wasn't just go out and save the hospital money. We never had one matrix that we were looking at. I think that, and Brian or Tim, correct me, but I think we had 6 or 7 that we looked at when we started looking at the environmental services program. So we looked at quality, we looked at HCAHPS, we looked at staff retention, we looked at patient satisfaction, we looked at the numbers, the dollars. Brian, I don't know if you remember what some of the others might have been.
Yeah,
but
infection
it
control,
wasn't an
infection
easy
prevention, even those things. Yeah,
Creating capacity, turnaround
creating
time.
capacity. Yep.
Yeah. And so we went through all of those to come up with what's the right solution. And when we sat down and looked at it, the in-house program just blew everything away. So it became, how do we do it? Fortunately, we had great leadership, and that's what started it. And that's really what propelled the facility management program. And there's others that aren't on this call today. Dennis Smith is one, and I know you've had him on other podcasts, Peter.
Yes.
These are solid leaders. These are solid individuals. And I have said it with all sincerity that these are people that I not only trusted with the business, I trust them with my life. They are there every day. They are focused on the right stuff and doing it. And when you listen to them, it's not going out and checking on them. You just have to listen to them. And as they were saying, getting the group in a room and talking and listening to what they're saying, they hold each other accountable. And it becomes very easy to start picking out the non-fit, if you will. The person is just not going to make it a long way. And, and these guys saw that. We went through that where we had people come on board and they weren't a good fit. And so we would struggle, and you could actually feel the program start to slow down. So, by being able to address all these different indicators, be able to go in and say, we're there to help. We are honestly here to help you do this. We eventually were able to mostly overcome the control issue, which was a big deal for a long time. Who controls the people? Who controls the money that goes into the program? And they all have it. Facilities management and clinical engineering were a little bit different in that they control a big capital spend. And so getting the right people into the room to hear what we were saying and where we were trying to go, and hearing what they were saying in response to that really helped us to build the programs that we pushed out to the markets over time. It's not easy and it's not overnight. I mean, you've heard us talk all the way from 2021 to today. And, you know, when I left in 2019, we were getting close to what I thought was possible. And I think that it would be wonderful to hear Tim and Andy, because they've taken these programs and they've pushed them on steroids. So they've moved healthcare a lot further ahead in the last 5 years than where I left it and left the system.
Yeah, and I
So-
mean, my God, think about it, it's a completely different world too, right? 2019 to now, you leave before the pandemic. I want you guys to answer that question, if you don't mind, that Skip just said, but also too, how do you, and I think it may be part, it probably maybe goes with your answer too, Skip, is how do you keep that culture alive and going today when there are so many external pressures on you, from everything from budget to people to, listen, the world wants more and more quickly today too. Everybody wants everything right away. How do you keep that culture alive and functioning in today's world?
I think you have to continue to show it. So I wanted to share just a couple of really quick examples of why I'm here and why I am part of this and why I will follow Skip anywhere. I deployed to Iraq in 2009 and 10. And that was part of CHI. And part of the organization said, you go, we got this. Don't worry about this. You're going to be good when you come back. I did that. I came back. Everything was really great. I deployed again in 2015 and 2016 under Skip and Dennis's leadership. They said, Andy, you go, we got you. There was this constant flow of care package to me and my team while deployed. And then I came back 2 months later, my wife is diagnosed with cancer. And I called Skip and I said, this is going on. He said, you go take care of her. We got this. We've got you. We've got your family. And that was so amazing to hear, because in the back of my mind, I know I just got back a couple of months ago, burnt 30 days of terminal leave, and then I'm back work 30 days, and then I have this. And it was absolutely without a thought. He said, you go take care of your family. And then as quickly as he said that, all of my other peers, they just surrounded me and my family. And if they found that I was working, I would get admonished by them saying, you go take care of them. You don't need to be doing this. It made it so much easier for me to focus on the care, because you have to be focused in that first kind of 6 months of the pre-care, the during, and then the after, that it was such a relief for me that I didn't have to worry about anything. So that was one of the great things that Skip taught about this team. And then we kind of still emulate that today. Just wanted to share that real quick.
And Pete, as well, to answer your question, if you don't live it, you don't believe it. And when you live it and you believe it, others believe in that as well. And they want what you got, and they want what you're delivering. And that's what we were very good at and consistent at. You know, I used to always think all's well and good with standardize, centralize, and automate. But we have truly done that and it's hardwired and it's sustained. So what we look like in Virginia Mason in Seattle, Washington, we look the exact same at Baylor St. Luke's Medical Center in Houston, Texas. We have standardized what we do, we've centralized how we deliver it, and we've automated our platform. And folks want to be a part of that. And when you get that infrastructure put into place, the rest falls into place. And what is tough is when we became CommonSpirit Health, folks wanted to cherry pick what they wanted to do and what they didn't want to do. And I'm like, look, everything is interdependent upon each element of the program. And it's taken 5 years, but we're there now. Not one outsourced company has a national dashboard where every one of their customers can see what they look like and compare against one another. We do. And it is so cool where we began and how one man had a vision to say, I'm going to put a ragtag group of guys and gals together and we're going to get it done. And he sure has. And you're looking at a part of many lives that he has helped bring out the best in each and every one of them.
Yeah, and just to add on to what these guys are saying too, a few other things and reiterate a few comments have been made is, I mean, there's so many strengths from Skip, and we all learned so much from Skip, and just can't thank you, Skip, enough for everything you've done for all of us. And you totally changed, I know, my life forever. in the way I look at it. But wanted to emphasize exactly what Andy said: take care of yourself first, then take care of everybody else, that kind of stuff. The I think how you just it gets baked into back what Tim said. It's just the way we operate now, and back to whoever said it in terms of the relationship building. And Skip was all about the relationships, and again, like I said in my opening, he was not afraid to bring in the disbelievers. I'll call them that. And so, and getting those small wins. And so in terms of Skip, he very much wanted to go find those people. And so even since 2019 as a part of our merger, I know that Tim and I we've worked together and same thing. You don't force something on somebody. You don't tell them, here's what we are going to do. You invite them to the table, you have that discussion, you get the easy wins, and both from people that are on your side and who started maybe thinking something different. And through easy wins, you get them on board. And believe it or not, all those folks that used to be disbelievers become your biggest salespeople going forward. And you lean on them. We've had a few examples where the ones that started off as disbelievers are the people we now lean on the most to help sell the program for us.
Yes.
And so it's being a true partner in every sense of the word. And that's one of the key fundamentals that I'll never forget and always will thank Skip for in terms of his leadership style.
Hey, Pete, real quick on relationships. Here's an interesting point about relationships. So, we kind of think about these relationships within the company, but then you have this relationship that you establish with vendors, right? And so sometimes you look at first costs for vendors and you just kind of beat them to death on the savings. But one thing that Skip taught us about relationship with vendors is if you have a good relationship, if you're that single point of contact, they're going to look out for you and not let you fail. They're going to look out for you with their companies, with their contracts. And I'll tell you what, I live with that to this day, where at my previous employer, I've had some direct conversations about, why do you want to have a close relationship with this vendor? And I said, because when this vendor becomes an advocate for you, they're not going to let you fail either within their company. So when they're in their meetings, they're going to speak out on your behalf at the table.
And Andy, that's absolutely beautiful, because we are very selective in who we partner with. And what's important to me is Mr. and Mrs. Vendor Partner, when folks see you, they need to see me. When they see me, they need to see you. If that happens, we have achieved what we set out to do with our relationships with our vendor partners.
Amen.
Yeah. And partner is the key word that both of you guys used. We don't treat those we learn to not treat them as vendors, that we treat them as partners. It's a true partner. It's not a vendor to us, it's a partner.
You were you gonna say something, Tim?
I'm going to be quiet for a minute. I'm getting all ramped up. This is awesome.
I was going to say, relationships, you gentlemen have all talked about kind of relationships and the relationship building, almost more you guys have talked more kind of about that soft skill side than the technical side that we talk so frequently about. Skip, I'm going back to you only because it's kind of, we talked about the formation. Have you always been that way? Have you always been relationship driven? Have you always wanted to kind of bring those, what did you guys call them? Not the outliers, that's my word. The
disbelievers is a term I use, but outliers is a good,
that was it. I like
term
that
too. Yeah.
Have you always been that way, or did you evolve over time when you were as a leader?
I think I've always leaned that way, but I evolved with time. I got better at it as time went on. I used to be a sole proprietor, and so you're in charge and you do it all. And then when I got into healthcare, the job kept getting bigger. And how do you find people to support you and the programs you're trying to put together and support the patients that we're serving and so on. So it was an evolution over time, to say the least. And part of it is that it's synergistic, if you will, because once you figure that out and you start bringing, this kind of talent in with you, you continue to learn from them too. And so it just it snowballs, if you will, as you go forward. And there's stories that I can tell about every one of these guys on this call, things that I have learned from them and how they approach something. And it's like, I hadn't thought about going that direction and doing that. So you have to be open. You could say this is one hospital, and these would be the same challenges one hospital would have. When we started the merger with Dignity Health, we were 110 hospitals. And we were probably 7 or 8 regions, if I remember correctly. And so being able to go out and touch all of them and get them to buy in and, figure out who's the leader and who's the informal leader. And sometimes it was a lot more important to know who the informal leader was than who maybe the president or the administrator was, because they would be the ones that would clear the path for you. So it's, I just want to be sure that people understand that this was very broad-based, very diverse, a lot of geography, a lot of air miles and stuff like that to be able to pull this stuff together. You asked the question about sustaining culture. One of the things that I was most proud of in being able to do for the markets, which I think helped bring them in, was we supported them, the facility directors and managers, going to either ASHE at a national level or going to their state societies. And that held true for EVS and everybody else. It's like, get involved, learn. There's people out there, build your network, have somebody you can call and go, hey, George Mills, I got a question. What do we do with this? And to be able to move forward. They were very good at being able to do that.
I'm sorry, Skip, I got to interrupt you. We've went, because of that, we went from an environmental services, from learning and going to AHE conferences to get the certifications, to now we are speaking and teaching at those conferences.
So because the other part where I was going with that is, in the hard times when money was being pressed, we didn't give up on that. We didn't give up on, giving them something that they were going to be able to learn. And we didn't cut our travel back that much. So we continued to travel. We continued to have face-to-face. And, there's certainly a place for Zoom, and there's a place for phone calls and so on. And I know these guys have heard me say this, and that is, if you're going to problem solve, you're going to do it in a room. Yeah. You're not going to do it over a Zoom call. It's just not, it doesn't happen as certainly as elegantly as you would like it to be. So it is certainly, I'm sitting here thinking these guys have been incredibly gracious, and I am truly humbled by some of the comments that have been made. It's being patient, it's staying the course with what you see as the big picture. One of the things that we talked about was making sure that they had the right environment for them to work. It's like one of the first questions when they got hired, you want to work from home? You want an office? What do you want to do? Brian's the one that rocked my wild card. He's like, oh, yeah. He's like, you want to work from home? And certainly lends it. Like, nope, I want an office. I do better in the office. And it's like, so, put them in an environment. The other thing they've heard me say is, I don't care how you do it, as long as it's legal, ethical, and morally up. It's like, you do it on your own time. You do it your own way. You know where I want to be at the end of this period. Let's just go do it.
So, gentlemen, we're coming up to a hard break. I hope can ask one question. You don't want to get corny because you guys have done a great job, but what is one lesson? And you can all, I'm going to give you one lesson that you've taken with you and you still use today in your roles as leaders. And I have to take off the table, proceed until apprehended.
Yeah, that's the biggest one that's the biggest one.
That's a great one. I'm almost tempted to use that as the title for this, proceed until apprehended. I love that.
So I'll chime in on that one. This group right here is experts at change. Lord have mercy, have we all been through changes in our career? And I'm saying that to lead with this. I've learned, and I'm taking this with me for the remainder of my days. Life happens, sometimes good, sometimes bad. Life changes, sometimes good, sometimes bad. Life goes on. Your choice. How life happens, how life changes, and how life goes on is drastically impacted by those you do life with personally and professionally. And this group is experts at that as well. And I'm blessed to be a part of that.
Thank you, Tim. Andy, let's go to you.
Yeah, I think you can't do this without building foundational relationships and staying spiritually grounded in this organization. That's everything.
Awesome.
Brian?
Yeah, I think knowing your mission, the relationships, things we've talked about, I think my biggest thing, again, I've spoken about it before, I think is the way I approach not being afraid of thinking outside the box, not being afraid to, I keep on saying, inviting those people at the table that may not be on your side initially, and actually embrace that. And that really changed me forever in terms of how I tackle challenges. So
I know that it's very hard to schedule people, and I would like to do it again because there's two things. Like for me, the relationship part of it was pretty profound. The proceed until apprehended, but the other thing I wanted to talk to you guys about, and I didn't want to take you off because you were talking amongst each other so well, and it was just good content. But I wanted to talk about a little bit about, number one, kind of the challenges. We didn't talk about that. The challenges you faced as you built the program, the pushback you got early on, getting people to kind of leave their egos at the door, because that had to be very difficult. And the third thing, Skip, it was that it kind of happened by accident relative, the genesis of systematizing. As you were telling the story, I always thought, before I asked you this, I thought maybe it was kind of, we're going to do this, and it was prescribed. It was very interesting to hear how it developed. I would love to have you guys back, maybe in the new year, maybe in 2025. Andy, you get reestablished back. Feeling good.
Amen.
I appreciate Skip, Andy, Brian, Tim. Thank you for your time today. I appreciate it.
Thank you.
well, thank you very much, and thanks again for all that you've done for us, Skip. So can't emphasize enough how you changed each and every one of our lives forever. You really did. So, and you need to know that.
Right after Skip.
Thank you, gentlemen.
All right. Love you,
Thanks,
Todd.
everybody.
Thanks, everybody.
Take care.
Take care.
Thank
Andy
you.
Martin for the Healthcare Facilities Network. As always, thank you for watching. Have a great night.